in the bottle. You probably get about, I think, 100 applications out of each kit. So it's real simple. You brush dry, it takes about a minute. It's a combination of water, alcohol, and acetone along with the bonding agent. And you want to leave the tooth a little bit moist because the capillary action will pull that resin into the tooth. So that's what eliminates your sensitivity. You don't want a bone dry tooth when you use this stuff. Again, I switched over to LED lights. I really love them. Put your flowable on first, and then put your stackable. And the reason why you always put flowable under your stackable, this is not supposed to be a composite course, but we know from research that when you cure your stackable composite, the composite wants to go towards the light. If you don't have flowable underneath there, you're going to get an air gap. The patient's going to have pain every time they chew on their tooth because you have fluid that's going in and out of that gap. So your flowable underneath your stackable gives you a better bond to your structural composite. And then I just go through my usual, everybody has their own favorite polishing. I got this from Ross Nash's course I took a couple years ago. If you like rubber wheels, that's cool. Just remember, a rubber wheel will heat the tooth up and cause more sensitivity. So I just like to go from a rougher instrument to a smoother instrument. And now I'm almost done. I got one more DVD to show you guys. This is going to show you how I use the single component adhesive.
It's dried, and then a 12-second application, dried, and then cured again. In this case, 19 is an endodontic access. The tooth tested out fine topaz, and the patient wanted to keep it for a while. 20 is going to be a core buildup, and then 21 is going to be a DO. Next, we put our flowable composite. Go ahead and cure that with the light. All 3 teeth. Then we place our structural composite, proximal boxes, condense that and cure that. Remember, never connect the buccal cusp with the lingual cusp to prevent tension from forming within the tooth. We'll then place more composite on the buccal side, condense that and cure it. Since number 20 is going to be prepped for a crown, we don't worry too much about proximal contacts. And then we want direct access to the distal 21 to polish that really smooth in order to help the flossing ability there. Next, we'll fill in the buccal side. Make it smooth with the burnisher, and then cure it one more time. Notice we move smoothly from one tooth to the next, using each tool to its maximum. Remove the automatrix, and then where the light could not permeate through the steel matrix, and you're going to go ahead and cure that again.
This is to blend your administrative part of the time that you spend in the office with your clinical. If you don't have any computers in your office yet, if you're thinking about digital radiography or computerized treatment planning, don't try and do it all at one time because you'll just get overwhelmed. The best thing to do is to start off with your administrative computer first, add the radiography and the digital photos near the end, and just take it one task at a time. Don't try and do it all at one time. Ask your friends in your town or your neighborhood what they're happy with. If you got any questions, email me. I'll be happy to answer them for you, tell you what works for me. And make sure you do your research. And then spend plenty of time with you and your family so that you have time to relax. This is my wife and my little dog down in Charleston. Thanks again. I appreciate it.